Welcome to the Scintillating Podcast, where we are shining a light on nuclear medicine. The field of nuclear medicine is experiencing unprecedented growth. We plan to give listeners an overview of nuclear medicine and its unique capabilities. Additionally, we plan to shine a spotlight on various specialties in nuclear medicine through our interviews with nuclear medicine leaders. Finally, we want to let our listeners know how to get involved and the benefits of nuclear medicine for patients. Thank you for joining us. We are starting this podcast series this year to tell the following. What is unique about nuclear medicine in the greater medical community? Why you should join and be a part of the Society of Nuclear Medicine and Molecular Imaging, or SNMMI, community. Today, join us in celebrating American Heart Month and see how nuclear medicine plays a key role in promoting heart health. Richard L. Weinberg, MD, PhD, serves as the Medical Director of Nuclear Cardiology in the Bluhm Cardiovascular Institute at Northwestern Memorial Hospital and is Assistant Professor of Medicine at Northwestern University Feinberg School of Medicine. Dr. Weinberg, thank you for joining us today on the Scintillating Podcast.
Thank you, Lance, and to SNMMI for having me. It's a pleasure to be here with you guys, especially as it's Heart Month. My name is Richard Weinberg. I am the Medical Director of Nuclear Cardiology at Northwestern Medicine and the Feinberg School of Medicine at Northwestern University, and I'm Assistant Professor of Internal Medicine at Northwestern University.
Excellent. Can you tell us a little bit about nuclear medicine and nuclear cardiology as you practice it?
Sure. So nuclear medicine, as I'm sure most of our viewers know, fundamentally relies on using a radiopharmaceutical to image some part of the body to help inform disease, as well as to, in certain cases, direct and even administer therapies. A particular subset of nuclear medicine is nuclear cardiology. And this is a discipline where we do the same thing. In essence, we use a radiopharmaceutical to help image the heart and help us diagnose and manage cardiovascular disease. We do that both with myocardial perfusion tracers, which are tracers that localize to the heart as a function of blood flow. So we can use those tracers to help diagnose and manage coronary artery disease. We also have specific radiopharmaceuticals like F18-FDG or fluorodeoxyglucose, which we use to inform us about myocardial viability and myocardial inflammation and infection in the heart. And then we have even other radiopharmaceuticals that are used to help diagnose and treat cardiac amyloid. Those are some of the major things that we do. And there are also a lot of interesting research efforts looking at new radiopharmaceuticals to help image fibroblast activation in the heart, innervation in the heart, and things of that sort.
Terrific. Thank you for that overview. Let's go back a little bit in time. Can you tell us why you decided to pursue a career in nuclear cardiology?
I'm a chemist by training. So prior to going to medical school, I actually studied chemistry and got my doctorate in protein chemistry. And one of the things that always fascinated me was how we could use advanced imaging techniques to inform biological processes. So when I went to medical school and I decided to pursue internal medicine and then cardiology as a training, a subspecialty of cardiology for me that spoke to me was nuclear cardiology, because the ultimate goal of nuclear cardiology is to use a radiopharmaceutical or a radiotracer to help inform physiology and to help us better treat disease. So that was my gateway into nuclear cardiology as a subspecialty.
If you were to speak to aspiring physicians and scientists, would you tell them about why they should pursue a career in nuclear medicine?
Of course, nuclear medicine is by far one of the most exciting fields in healthcare. And I say that for a variety of reasons. Nuclear medicine in general subtends everything from basic science research for development of new radiotracers and radiopharmaceuticals, engineering research where we're developing better cameras to image our patients, all the way through to clinical trials for theranostics and diagnostic algorithms to help better understand disease. So from a personal perspective, when I was a younger faculty, and even as a fellow, I became very involved in the Society of Nuclear Medicine and Molecular Imaging during my training. And I found my passion in cardiovascular medicine and cardiovascular imaging, so I joined the Cardiovascular Council. And I worked my way through as an intern, board member, and now as presidents of the council. And I would say to people at the early part of your career, if you're really interested in nuclear medicine, join the societies, become a member of SNMMI, join imaging sections of the American College of Cardiology or the American Heart Association or the American Society of Nuclear Cardiology, speaking specifically to cardiovascular imaging. And once you have done that, you can get mentorship as well as education from these societies. And when you find that area that you're really passionate about, become involved, whether it's from the clinical side in doing clinical research or really becoming an expert in clinical imaging so you can better treat your patients, to developing novel AI algorithms or working with engineers to help develop better cameras. You can pick something that you're passionate about and really explore it both clinically as well as from a research perspective.
Can you talk to us more about your current practice and how you use nuclear cardiology to promote heart health?
What I do every day really is twofold. I am a clinical cardiologist, so I see patients in the office as well as in the hospital and treat everything from patients who have high cholesterol and high blood pressure to people who have unfortunately needed heart surgery or who have had a heart attack. I do that about 50% of my time. And then the other 50% of my time, I run the nuclear cardiology lab here. So we do perfusion imaging for SPECT as well as for PET imaging, amyloid imaging, as well as viability, infection, and inflammation imaging. So, nuclear medicine does play a key role in my day to day operations as a healthcare provider. But I would say more generally, it fits a very important role for people who practice general cardiology and medicine, more broadly speaking. And I say that because heart disease is the number one killer in the United States. I think I'm on pretty safe footing to say that everyone listening to our interview knows someone who has suffered from some type of heart disease. And nuclear cardiology and cardiac imaging in general can help diagnose patients early, give us information to help better prevent heart disease. And then in those patients who have suffered from heart disease, can actually help better care for those patients in the long run. So, for example, in people who are at risk for heart disease, who need to figure out whether or not they should be taking cholesterol or blood pressure lowering medications, a type of imaging test called a coronary artery calcium score is very helpful to help diagnose what's called subclinical disease, meaning you don't have any symptoms that would make us worry about your heart. But if we can detect that you have calcium in the arteries that supply blood to your heart, you're going to be at higher risk for heart disease down the road, and you benefit from more aggressive risk modification, whether it's blood pressure lower, better diet, exercise, diabetes control, cholesterol control. And while this is a CT-based technique, if you have a hybrid imaging camera like a PET CT or a SPECT CT, we routinely do calcium scores on our patients in addition to all of our nuclear imaging. And then to take it a step further, in the nuclear imaging, for people who have coronary artery disease, so those are blockages in the arteries that supply blood to the heart, we can use cardiac PET or cardiac SPECT myocardial perfusion imaging to diagnose that, or in people who have disease to actually inform us in terms of clinical prognosis and to aid in our treatment selection to what to do for them. And then in my practice, again, I also see patients who may have cardiac amyloidosis. So nuclear medicine imaging techniques, for example, technetium pyrophosphate or PYP scanning or HDP scanning, and in Europe we use DPD, is very important in being able to diagnose people who have transthyretin cardiac amyloid. And then there are other more specific imaging techniques that we can use. So people who may have an inflammatory problem with their heart, like a myocarditis from sarcoid, among other different causes, we can use FDG imaging in the heart to diagnose and help treat those patients as well. So it's not just for the nuclear imager. As a practicing cardiologist, I use these techniques in my day-to-day practice and when I'm taking care of patients in the hospital.
Dr. Weinberg, on a more basic level, can you tell us what is unique about nuclear medicine in the field of medical imaging and in the larger context of modern medicine?
If I were to think of the most unique thing about nuclear medicine techniques in general, is that we as a group have radiopharmaceuticals or radiotracers, which can, in certain cases, actually inform physiology. So instead of just getting a picture of an organ or a picture of a patient, if we use a nuclear medicine technique, we can actually, in certain cases, glean insights into the actual disease process, the pathophysiology of certain disease. And to give you an example, cardiac amyloidosis is a field that until recently we couldn't diagnose efficiently and quickly. And over the last 15 years or so, we've seen the emergence of bone scintigraphy tracers to help diagnose cardiac amyloid or certain types of cardiac amyloid. But the most exciting thing about this field, and this speaks to your question about nuclear medicine in general, is that there are new radiopharmaceuticals which are now in phase 3 clinical trial, which actually can bind to amyloid directly. And that's unique. No other type of imaging modality outside of nuclear medicine has the capability to design a molecule, attach it to a particle that will emit radioactivity, which we can then image, which will then, by definition, inform what's going on in someone non-invasive. So it's an extraordinarily powerful technique. And you can see this in applications for treatment as well with theranostics. And hopefully, as we continue to improve our radiopharmaceutical pipeline, we'll be able to develop more disease-specific tracers, whether it's for the heart or for certain types of cancer or things of that sort. And down the road, the future looks quite bright for nuclear medicine.
Thank you for sharing your perspective on the unique value of nuclear medicine. Now, if you were to speak to one of your patients, what do you think they need to understand about having a nuclear cardiology procedure?
Sure. So, by far, the most common nuclear cardiology procedure that's performed that I order for my patients is a myocardial perfusion imaging stress test. And that comes in, broadly speaking, two flavors. One is a SPECT myocardial perfusion scan, and the other is a cardiac PET myocardial perfusion scan. Fundamentally, the radiopharmaceuticals are different, the camera technology is different, and there are some differences in imaging technology. But broadly speaking, what I tell my patients for either test is as follows. We want to be able to get a better idea of the blood flow to your heart. I'd like to send you for an exam called a nuclear cardiology stress test. This test will inject a small amount of a radioactive substance that will go to your heart as a function of the blood flow to your heart. You'll get injected with a small amount of this substance and then get pictures of your heart. Following that, we're going to perform a stress test, and that will either be you're exercising on a treadmill or you're receiving a chemical that will make the blood vessels to your heart dilate or get bigger to increase the blood flow to your heart. And while that's happening, we're going to inject you with a second dose of this radiopharmaceutical. And that will also go to your heart as a function of blood flow. And we'll compare the pictures during stress to the pictures that you had at rest. And we'll see if there are any differences. And that will allow us to tell with some degree of certainty if you may have imaging evidence of a blood flow problem to your heart. And at the same time, we'll be able to evaluate the size and the function of your heart during the test. So that's a general primer that I give to my patients when I'm explaining to them the test that I'm ordering in the office.
Thank you. That's very helpful for our patient listeners. February is American Heart Month. What message would you like to share in regards to this initiative?
Well, as much as I love nuclear medicine and nuclear cardiology, I think that this is by far the most important question that you've asked me today. So even though I'm a nuclear cardiologist, I'm actually a preventive cardiologist. So I specialize in cholesterol, blood pressure control. While I treat a lot of heart disease, my number one goal is to prevent heart disease. So the message is quite simple. Heart disease remains the number one killer in the United States. And unlike other diseases, heart disease in a lot of conditions is preventable. And so my message is it's better to prevent and it's better to know what your risk is before anything happens. And so as this is American Heart Month, really what I tell people is know your numbers. Go to your doctor. Make sure you know if you have high blood pressure or not. Make sure if you know if you have high cholesterol or not. Make sure you know if you have diabetes or prediabetes or not. And if you do, there are very effective treatments for all of these conditions, which can help significantly reduce your risk of a heart attack or a stroke. The American Heart Association feels very strongly about this. And I would direct our listeners to Life's Essential Eights. And this is a program and a set of guidelines that has been promoted by the American Heart Association. It outlines 8 easy steps you can take to live a healthier lifestyle. And I can go through them because I think they're that important. The first one, eat better. You want to have an overall healthy eating pattern with a lot of whole grains, fruits, nuts, vegetables, lean proteins, and cooking in healthy oils, for example, olive oil or canola oil. You want to minimize processed foods, fried foods, and saturated fat. Number 2, be more active. The recommendation from the American Heart Association and other professional societies is to target at least 150 minutes of moderate physical activity per week or 75 minutes of a vigorous physical activity per week. So brisk walking, for example, is moderate physical activity, or high intensity aerobics or going really quickly or vigorously on a Peloton or running on a treadmill would be vigorous activity. Number 3, quit tobacco. Use of nicotine products is one of the most preventable risk factors for heart disease. Number 4, and this is one that most people probably don't think about, but healthy sleep is a key part of heart health. So adults, the recommendation is between 7 to 9 hours of sleep per night. Adolescents, children, babies need more. Weight, managing your weight. Achieving a healthy weight is extraordinarily important. You may know that there are new medications that can help people who have other risk factors lose weight, which can decrease the risk of kidney disease and heart disease. So maintaining a healthy lifestyle and maintaining a healthy weight is a key part of maintaining your heart health. Cholesterol control is the next one. So we want to make sure that you have normal or elevated levels of high density lipoprotein, the type of cholesterol that has a protective effect against heart disease. And then conversely, low density lipoprotein or LDL cholesterol. That is the type of cholesterol that the higher it is, the more it's associated with your risk of heart attack and stroke. So if you speak to your doctor and your cholesterol is above a certain threshold based on your age and your other risk factors, you may be a candidate for cholesterol-lowering medicines, which have been shown to reduce the risk of heart attack and stroke. Managing your blood sugar, knowing whether or not you have diabetes or something called glucose intolerance, which is prediabetes, is extraordinarily important. And routine testing and blood work at your primary care internal medicine physician's office is a good way to make sure you know whether or not you do or don't have that. And then finally, the last one of Life's Essential Eights is blood pressure. Keeping your blood pressure within acceptable limits can make you live longer and decrease the risk of stroke, heart failure, and to a certain degree, heart attack. Ideally, we would like blood pressures to be at minimum less than 130 millimeters of mercury for the top number, which is called the systolic blood pressure, and less than 80 millimeters of mercury for the bottom number, which is called the diastolic blood pressure. We define high blood pressure as anything above 130 for the top number or anything above 80 millimeters of mercury for the bottom number. So knowing your numbers, following Life's Essential Eights are the recommendations that we give people to live a heart healthier lifestyle, and a very appropriate message for American Heart Month.
Dr. Weinberg, thank you for that excellent overview of prevention of heart disease. Such an important message. And our ultimate goal in nuclear medicine and any discipline in medicine is to prevent disease. I imagine those are also applicable after diagnosis and throughout your life. You mentioned earlier how joining the Society of Nuclear Medicine and Molecular Imaging was very valuable early in your career. Can you tell us why you continue to be engaged in the SNMMI and what benefits it brings to you?
Of course, it's my pleasure. So the Society of Nuclear Medicine and Molecular Imaging has been a very, very important influence in my professional career, both from a clinical perspective, an educational perspective, and an academic and a research perspective. And I know our viewers are coming from all different types of professions, whether it's an academic center or a practice in the community, they're all equally as important. The society allows you to pursue a variety of activities, whether it's your fulfilling your educational requirements, learning from the best and the brightest in terms of cutting edge research in your field, And then also being able to network and meet people to get their opinions on challenging, complex clinical cases. From a personal perspective, I'm very invested in the society, and in particularly with the Cardiovascular Council. We are very, very passionate about educating both our current colleagues as well as developing the future generations of nuclear medicine and nuclear cardiology imagers. And perhaps the most exciting thing about it is the education. And it's not just for what we have right now in clinical practice, but currently we have new radiopharmaceuticals that are actively undergoing clinical trials for imaging cardiac amyloid. We just have the approval of a new myocardial perfusion tracer called flurpiridaz, which is going to be available in the next 2 to 3 months. And so it's really a privilege and it's super exciting to be able to be part of an organization, not just to educate people on what we have now, but to help set the stage for what we're going to have in the future. So that is really the reason why I've maintained my involvement and become more involved in the society. And I'll also say the personal and professional relationships that you can develop with the society is quite unique because it's not just with the Cardiovascular Council. I've made friends and learned from colleagues in all of the other councils of the society. So you can learn and get different perspectives on clinical questions or research questions, and you may learn things you wouldn't have ever thought about because we have such a breadth of membership.
Thank you so much for sharing how the SNMMI has benefited you. It is a great privilege to have you among our membership, and I want to thank you for your time and sacrifice to help teach and lead. You mentioned that you are the current president of the Cardiovascular Council for the SNMMI. Can you tell us a little bit about your current goals, some of the initiatives you are working on, and finally, how people can get involved in this council?
But of course, it's actually been a privilege to be involved in the Cardiovascular Council since I enrolled as a fellow member. The council really has, I would say, three interlocking and interrelated goals. The first is education. The second is providing the means to deliver excellent clinical cardiovascular care through nuclear cardiology imaging. And the third is to promote research. We just finished our midwinter meeting where we had a cardiovascular focus track where we gave 20 hours of continuing education credits. And we involved people not just from the Cardiovascular Council, but from a variety of other councils to talk about artificial intelligence, correlative imaging, vasculitis. So just because you're a member of the Cardiovascular Council or you're involved in the Cardiovascular Council doesn't preclude you from being involved in the other parts of the society. We always welcome people to come in and collaborate with us. In the next couple of years, I think one of the most important things that we will be doing is our educational mission. And I focus on education because, as I said before, we have a new myocardial perfusion tracer, which is the first one in, I believe, about 20 years. And it's very exciting. It's an F-18 based myocardial perfusion imaging tracer for cardiac PET imaging called flurpiridaz. It's our society, the Cardiovascular Council. Some of our members did the pioneering work on this radiopharmaceutical and have helped with the phase 3 clinical trials that led to its FDA approval. So we're very excited to give educational content and partner with other societies so that when this does enter into clinical practice, people feel comfortable to use this. And also to engage in more research to understand how it compares to our SPECT tracers, as well as our approved myocardial perfusion PET tracers, namely rubidium and ammonia. So that's one major focus. The other one, I would say also is, as I said before, we have new amyloid imaging tracers that are in active phase 3 clinical trials, which many members of our Cardiovascular Council, myself included, are involved in. So it'll be very exciting to see how we can use that to better treat patients who have cardiac amyloid and to better diagnose people with cardiac amyloid. So from the educational perspective, I can't think of a more exciting time to be involved in nuclear cardiac imaging. And that dovetails right into the research efforts as well. I talked about what's been going on with flurpiridaz, with amyloid tracers. We have our colleagues who are SNMMI members who are working on new radiopharmaceuticals to image infection and inflammation and understand what happens to the heart after Someone unfortunately may have suffered a heart attack or suffered a stroke, and these are all exciting research initiatives. And then development of new talent. We have a cardiovascular intern. We have either one or two a year, depending on our applications. And that's a great way for early career members to get involved if you want to become involved in this society, and in particular in the Cardiovascular Council. And that's how a lot of our current board members and leadership have become involved, myself included. So I think in the next year or two, you will see a lot more educational and research content, particularly directed towards amyloid and myocardial perfusion imaging tracers. We have a lot of documents which our council and our members of our council are working on. And we really look forward to sharing all of this with our membership at the upcoming annual meeting in New Orleans in June.
Terrific. Thank you, Dr. Weinberg, for your leadership on this council and this overview. As you mentioned earlier, one of the unique advantages of nuclear medicine is that we're actually able to see physiology in real time. In addition to that, can you speak about how we are using these advanced medical images to measure quantitatively markers of disease?
Absolutely. So I think I'll divide this into coronary artery disease and myocardial blood flow, and then talk about quantification of other types of disease as two kind of separate subtopics. So, myocardial blood flow can be calculated both using SPECT technology as well as cardiac PET technology. I think the majority of us using it in clinical practice really focus on using cardiac PET because we have more data published on it. And this is important because in addition to looking at images of the heart and to take a look at the blood flow to the heart, we can actually quantify the blood flow to the heart at rest and at stress. And independent of what the pictures show, these data give prognostic information. So that's one very important point to make about cardiac PET imaging and quantitative myocardial blood flow analysis. So it helps with prognosis in disease for sure. Here's some data coming out of labs from some of our SNMMI members showing that it can also help decide treatment selection in retrospective studies of large data sets of up to 10 or 12, 14,000 people. So that's one big area. It also allows us to, with more diagnostic certainty, diagnose coronary artery disease if you have a visual abnormality on your pictures, as well as abnormalities in blood flow. So the other subset here would be using quantitative metrics in other diseases. And I'll focus on two examples. So inflammatory cardiac diseases called myocarditis, there's a particular type of disease called cardiac sarcoidosis. And we use FDG PET CT to evaluate for the presence of myocardial inflammation in people who have cardiac sarcoid or who are suspected of having cardiac sarcoid. And we can measure a standard uptake value. And there are active clinical trials taking a look at using quantitative metrics of FDG to help better guide treatment for people with cardiac sarcoid. So that's a very exciting application of quantitation. Another one would be cardiac amyloid. So currently, bone scintigraphy tracers, PYP, HTP, DPD, are being used to diagnose transthyretin cardiac amyloid. And there's emerging data taking a look at changes in SUVs or other counts to see whether or not it correlates to response to therapy or not. The exciting thing about the amyloid space is as we develop PET radiopharmaceuticals to image amyloid, that will be very amenable to SUV measurement and quantitation. And whether or not changes in SUV uptake with these novel PET radiopharmaceuticals for cardiac amyloid could help dictate treatment response as well as dictate the decision about whether or not to initiate people on therapy. So that's exciting stuff that hopefully in the future we'll be able to see. So there are a lot of applications of quantification for helping with the diagnosis and management of patients with cardiovascular disease.
Dr. Weinberg, this has been an illuminating conversation. Thank you so much for your time. In conclusion, can you help us see what sparks your passion for nuclear medicine?
I think it's a combination of different factors. So as a clinician as well as a cardiac imager, I'm in a lot of ways on the front line when I see patients in the hospital and when I see patients in clinic, to be able to offer them a safe, rapid, and in most cases available imaging technique, which can help diagnose the disease as well as inform prognosis and, in certain cases, treatment selection, is a very powerful tool to have. And being able to work at the interface of chemistry, nuclear medicine, and clinical cardiology is something that makes me very happy and fulfilled when I can provide that sort of patient care. In addition, being able to work in the crossroads of basic research, engineering, or collaborate with my colleagues from an engineering perspective, as well as my colleagues from a clinical perspective, really is a unique opportunity to draw on a variety of people with different expertise, with the ultimate goal of taking better care of our patients, our colleagues, and our family members. And I think for all those reasons, being involved in the nuclear medicine and nuclear cardiology community is extraordinarily important and extraordinarily meaningful for me. It's been a pleasure. I really appreciate the opportunity to speak with you, Lance, as well as want to thank the SNMMI for allowing me to speak to you on this podcast.